with the neck, these are just all simple range of motion activities, and I promise these are the ones with the neck pain, the headaches at the end of the day, these are the ones that fix it. So, extension. All you got to do is lay your head back and look at the ceiling. What this is doing is decreasing the poking chin. It's allowing us to get the good C curve back in our spine. And just hold it for 12 seconds and come forward. With the extension, this is one where you don't want to roll around back there, and you don't want to put any pressure on it, because that closes down where the nerves exit, so you could get a little pinching. So we just want it to rest, as cool as this looks. And let it sit. The other one, flexion. So this one, you just drop, and I always put a little bit of pressure with my hand and pull and hold. And some of y'all might already be tight from just this morning, and you'll feel right at the base of the skull some pulling and tightness. So if you feel a tension headache creeping up, start with this one. The other one, rotation, and it's the same. You can just put a little pressure on your chin. If you have TMJ issues, I don't recommend doing that. Just turn over and just let it stretch naturally. And then to the other side, same thing. And then you can tell on these, some of you might notice, I feel like I'm not rotating as far to the right as I am to the left. That's something that chiropractors can fix. Lateral flexion. This. I know. I don't know what I was thinking. This one's real good. This is another one for the tension headache. This muscle and this stretch is what I work on the most in people, and it's usually they get shoulder pain. It's right here, and they feel like they're having trouble rotating a little bit. So what you do is you take the hand, pin it under the seat, and then we're just going to put a little pressure on the side. And the reason we're pinning is because if we don't and we want to keep pulling, we'll just keep rotate. Our shoulder will keep coming up with it. And if you want to do on that one, you want to go slightly forward. If you feel a better stretch at that angle, the muscles are different on everybody. And then same on the other side. Okay, now low back. This one I usually do. We just have, I think there's 3 for this one. For forward flexion, I usually get my hamstring stretch in with it, so I get my feet out in front. Hamstrings are important because they will pull on the back of our pelvis and can straighten out the spine and cause back pain by that. So that's a good stretch, right? Okay, then extension, I usually just put my hands behind the seat and just lift and let my chest come forward and just arch the back a little bit.
Do you have these exercises anywhere?
Has what?
Do you have these exercises anywhere, like on your website or pictures of what you're doing?
I'm gonna have to use this
I'm
video right
filming.
Oh,
Maybe I can send it
And
to
then
you.
rotation on this one, it's just a subtle pull. If you get some pops, those are the good ones. Just don't be sitting there and grab it, and I'm sure you see kids do it sometime where they just it only takes one bad one of those where something goes wrong, a nerve's pinched, and you're wishing you wouldn't have done it. Okay, so that's the spinal hygiene one. Those ones, I promise, those help a lot. They seem simple, but they're strengthening and stretching exercises, so they will help a lot. I swear, if you do them once a day for a full week, by the end of the week, you'll already be noticing you're just sitting a little bit taller and you feel a little bit less pressure. Okay. These are just general ones, some extra ones. Some people get shoulder tightness, just the basic shoulder roll. I usually go 12 forward. These ones always look cool too. I apologize. And then 12 back. But these are good because we have so many nerves that come off the neck and travel through these shoulders, and this is just one that opens up the shoulder joint and allows stuff to pass freely. Okay, cat and camel. For cat and camel, I usually just hold my thumb, and it's just a stretch out in front. I like this one. And we just hold for 12 seconds. And I just kind of got my back just rounded forward.
Is that where the camel comes in?
I actually think this one's the cat. The next one, when we're coming back, it's kind of like what we just did, and it's just kind of, this one's a little more awkward, but once again, pulling the shoulder blades together in the back. So if I had a finger between my shoulder blades, I'd be trying to pinch it. And that's going to help strengthen those and, again, stretch the chest muscles in the front. Leg cradle. Okay, so for sciatica, a lot of times people, I don't know if y'all know, I'm sure most of you have heard of sciatica. And what it generally is nerve pain going down the leg. Okay, so there's another one called pseudosciatica. It feels very similar to it. But what happens in this one is one of the muscles we're sitting on right now. It's a little strap-like muscle, and that big sciatic nerve either goes over it, under it, or comes right through it. In any one of those scenarios, if this muscle is too tight, it's going to put pressure on the nerve. And with that, it'll shoot it up the back and make it seem like you have real bad back pain, or it'll shoot it down the leg, and usually when it's that one, it stops at the knee, it doesn't go to the foot. So, the leg cradle. And you might, when we do this side to side, it's just crossing the leg, figure 4, let the knee drop a little bit, and a lot of y'all might even feel this in the hip already, and then we're just going to lay forward.
I can see how it works.
So this is for that muscle. And this is the one, if husbands are still putting wallets in their back pocket, you're going to tilt the pelvis and you're putting extra pressure on this muscle so they get an increased flare-up of it. Now on this one, so you can see my right one, it drops, pretty good. My left one, I stretch this one all the time, but you can see it doesn't drop quite as far. So it's my go-to stretch that I've been trying to work on lately, so I'm not up here being a hypocrite. And then just lean forward. And this one burning on me. And you know, I recommend a lot of times too, before I tell patients when they come in, I say this, now that we've done stretches and we've found your tight muscles, on your mornings where you're waking up and you're sitting there thinking, I'm in big trouble, this is the day I'm going to have to go see the doctor, try the stretches first to see if the muscles will let go, and sometimes the muscles in the buttock will let go and the back pain just vanishes. Okay, we got one more. Everybody loves abs, right? We can do crunches in our seat. This one, all you got to do is lift your feet up off the ground. Just hold it. You can get your hands up too, and you'll just start feeling the abs are contracted. This one usually you can hold for 12, you can work your way to 30, you can go up to a minute. If there's not too many people around you and you don't want to be real distracting, you can do just little leg pumps, and then you're getting like a reverse crunch. So now we've pretty much covered every joint we need to. I mean, there's a lot more stretches we can do, but I promise these are the most important ones.